Hello, everybody. My name is Ariane Burks. I am a licensed health insurance agent, and this is my first video. I'm putting it out around annual enrollment period because it's always been my dream or my goal to educate my Medicare community. So in this video and on this channel, we're going to talk about insurance, specifically Medicare. If you have questions about Medicare, if you have questions about enrollment periods, annual enrollment period, open enrollment period, special enrollment periods, we're going to delve into a lot of that. We're going to talk about some Medicaid programs, and then we'll also talk about things like what you may qualify for, like low-income subsidies and other Medicaid programs like QMB, or programs basically, in other words, that assist you with paying for your Medicare Part B premium. I'd also like to talk about, like I said, since we're getting close to annual enrollment period, which is actually going to be this Saturday, October 15th to December 7th, I'd like to talk about what could be or might be best for you, so we can possibly minimize confusion. Most of the time in my area of work, there is a lot of confusion about Medicare, what kind of plans you might be eligible for, what you might be interested in, and actually really what you are you're supposed to do versus what might be an elective for you. There's a lot of confusion about that as well. So I like to just take this first video to just talk about what Medicare is, break it down for you, and then also what plans are available to you, and what might suit you best, so that you can be more educated and have less confusion going into these enrollment periods that are coming up. And hopefully, if you like the video, you can share it. Please, if you have comments, please leave them, or if you have questions, please leave them in the comments. Let me know. I'll try to answer any questions that you might have. So like I said, that it's less confusing for you. So we can definitely get started. So what is Medicare? There's lots of videos on the internet, but if you don't know, Medicare is a national insurance plan. It was started in 1965, and it used to be administered by the Social Security Administration. But now it's covered under Center for Medicare and Medicaid Services, which is, CMS for short. Medicare, you can get it two ways. You can either age in or drop in. Age in means exactly what you think it does. You have to be 65, at least 65 or older to get on Medicare. And if you drop in, that just means that you had a qualifying disability before you turned 65 that made you eligible for Medicare. You have to have a qualifying disability for 24 months or more, and that will qualify you for Medicare. Most of the time you might be on SSD or Social Security disability. And so Medicare Part A, if you worked enough quarters, it's free. You don't have to pay anything for it. It's going to cover things like hospitalization, inpatient hospitalization, skilled nursing facilities, or what you might call inpatient rehab. And it does cover some aspects of hospice. Part B is everything else. So Part A is called hospital, Part B is medical. So it's everything else. It's your doctor's office visits, it's your blood work, your preventative visits like your colonoscopies and your pelvic exams and prostate exams. It's durable medical equipment, wheelchairs, crutches, canes, everything else in between that you can think of. Immunizations, not the ones you have to get, not like shingles or anything like that. That's a whole nother story. But pneumonia, flu vaccines, that's all covered under Part B. Chemotherapy treatments, that's all Part B. Now, unless you meet the income requirements for Medicaid and the state that you live in is helping you, your Part B is going to cost you, I believe right now it's $170 and some change. I have to check that, double check that, but it's around $170. If you made more throughout your life, then your Medicare Part B premium could increase, but it's usually around $170. And then just touching on what I said before, if you qualify for Medicaid, which means you meet the state that you live in's income requirements, if you have limited income, they will put you on a program with your state, a Medicaid program, and it's usually called QMB, or Qualified Medicare Beneficiary, or SLMB, which stands for Special Low Income Medicare Beneficiary. And that's just a fancy term to say that the state that you live on feels like you meet the income requirements so that you cannot afford your Part B premium. And so the state will pay it for you. They may pay a portion of it, or they may pay all of it. Most of the time they'll pay all of it. And so together with Part A and Part B, they cover 80% of your, Medicare covers 80% of your hospital bills, your doctor's office visits, things like that. And then you are responsible for the other 20%. And that 20% can vary, obviously, based on the services that you have rendered. So if you're a person that is fairly healthy, you go to the doctor every couple months, maybe go see a specialist, Medicare is going to pay 80% of that, and your 20% most of the time is somewhere between $8 and $25, depending on what's being billed. Now, most people are fine with Medicare. They don't really need anything additional. If you like I said, if you're not a person that has a long-term illness or a terminal illness, Medicare works fine for you. You go get your checkups every couple of months. Like I said, you go see a dermatologist, chiropractor. That 20% isn't really hurting you, or it's something that you can manage. So that leads me to my next point. A lot of times as a health insurance agent, I have gotten, what am I supposed to be enrolled in? I'm getting all of this paperwork, because if you are a Medicare recipient, you are bombarded with paperwork every year around October, or calls, because all of the plans, they want you to come over to their plan. And you'll hear words like supplements and Medicare Advantage plans, Part C, Part D. What do I get enrolled in? And so the answer is, the only thing that you are obligated to have at 65 or older, or if you're on Social Security disability and you're on Medicare before 65, the only thing that you're obligated to have is Medicare Part A and B and Part D. We don't want to forget the drug portion, because if you do, you could be penalized. You will be if you are without prescription drug coverage for 63 days or more. You could incur what's called a LEP, or a late enrollment penalty, which will follow you until death. If you don't appeal it for an eligible reason. But if you don't enroll into Part B on time, and you don't enroll into Part D, as in your drugs, and you go without creditable drug coverage for 63 days or more, you will incur a late enrollment penalty that you will have to pay to Medicare every month. So like I said, what you're obligated to get is Medicare Parts A and Part B. Those are the two things, and D. Those are three things that you need. Now, if you're a person, let's just say you're a person that has a lot of surgeries, you have cancer, you have a lot of chemotherapy treatments, radiation, things like that. You possibly have a feeding tube, something along those lines. Then you might want to look into a supplement plan. A supplement plan is going to be, it's going to cost you something every month. And what that supplement plan is going to do is it's going to pick up the 20% that Medicare does not cover. So you go and have your services rendered. Your doctor or the hospital submits a bill to Medicare. Medicare pays their 80%, and the supplement pays the other 20%. So that way you're never seeing a bill. The only bill that you will see is the bill that comes from the company that you are enrolled in, and that could be Blue Cross, it could be AARP, Mutual of Omaha, Bankers Life. They all have supplement policies. So and they range somewhere between, I think the lowest I've ever heard of them is $50, $60 a month. They go all the way up to the highest I've ever heard is like $300 something a month for one supplement plan. And keep in mind, you'll be paying your Medicare Part B premium, the $170. You'll be paying the price of the supplement, and you'll also be paying your Part D, whatever company you choose to have your Part D prescription drug coverage through, you'll be paying that. So you'll have 3 premiums to pay. Now, your supplement plan does not cover anything except the 20%. There is no vision, there is no dental, there is no hearing. It just is there. It's designed to pick up that 20% that Medicare doesn't cover. Sometimes there are a couple of plans that will cover your Part B deductible, and they'll cover your Part A deductible for hospital. So if you're ever inpatient in the hospital, you owe a Part A deductible. Last I checked, and I will check the numbers for sure, but last I checked, it was around $1,400 for an inpatient hospital stay that you owe to the provider before Medicare kicks in. So some supplement plans will cover that hospital deductible for you, and sometimes I believe there's one that covers your medical deductible as well. And then I kind of want to just go back some, because what does Medicare cover? There are a lot of people that just don't know what that is. Medicare covers whatever is medically necessary. So you fall and break your leg, of course they're going to cover that. You have diabetes, Medicare is going to cover your strips, your testing strips, your solution to clean, your meters. They're going to cover all that, lancets, things like that. You have sleep apnea, they're going to cover your CPAP, BiPAP machine, crutches, like I said, wheelchair, whatever is medically necessary. What Medicare does not cover is anything that they deem a convenience. That's why I've gotten a lot of calls about whether Medicare covers wheelchair ramps for your home. They don't. Sometimes the bath rails to hold on. In some instances, sometimes if you're with a Medicare Advantage plan, the Advantage plan that you're with may have that additional benefit tied into that. Other than that, they don't pay for it. They don't pay for incontinence supplies like adult diapers and the liners. They don't pay for wheelchair lifts. They will cover the mechanism to the lift, but they won't cover the lift itself. They don't cover someone to come to your home and sit with your loved one or sit with you unless it's home health care where they are bathing you or they're helping with like occupational or physical therapy. They're helping you with day-to-day living. They don't cover anything like that. So, which brings me to, like I said, no hearing, vision, dental, things that kind of start to go or decline as we get older, right? So that's where the next plan comes in, and that's a Medicare Advantage plan. Now, you may hear a Medicare Advantage plan referred to as Part C or a Medicare replacement plan. You'll hear your doctor's office or hospital say that, oh, you have a Medicare replacement plan. It doesn't really replace Medicare. It does act as Medicare while you're enrolled in that plan. And so what is a Medicare Advantage plan? So Medicare Advantage plan is, we take it by the word advantage. It covers everything that your Medicare covers, so hospitalization, skilled nursing facility, rehab, durable medical equipment, surgeries, and then it also covers additional benefits that Medicare does not cover, like vision, dental, and hearing. And it's evolved so much over the years. It's even including now transportation. That used to be a thing that was only reserved for people that had limited income or were on Medicaid. Some of the plans are including transportation, over-the-counter benefits. If you're a person that likes to take vitamins or you take aspirin, Medicare Advantage plans will help you out with that. They'll give you money towards your vitamins and other over-the-counter items. Some people get like Flonase or Prilosec, things like that. And of course, the biggest benefit that people love is it covers your vision, dental, and hearing. And so most of them cover somewhere between $100 to $500 for glasses or contacts. That usually includes lenses and frames. Some of them cover up to $2,000 for hearing aids or more, depending on, like I said, if you have a dual plan, if you have both Medicare and Medicaid. And then it also covers dental work, which is huge for a lot of my Medicare community, not even just my seniors, just my Medicare community in general, but really with my seniors. Dentures are expensive. Dentures probably cost, now $3,000, $4,000, $5,000. Some of the plans cover dental implants, which is another thing that's super important to my Medicare community. So other than that, these are things that Medicare normally does not cover. And so the price of most Medicare Advantage plans, they're usually always they have a very small premium or no premium at all. Most of the time in my case, I've seen Medicare Advantage plans, they are $0. And so the biggest question that I get that anytime I've gotten resistance about Medicare Advantage plans is, then why isn't everybody on a Medicare Advantage plan? If a plan is covering my vision, dental, hearing, it covers all of my medical services, why would someone give this plan away? Why would it only be $0 per month? And so most people, they hold back because it just feels like it's too good to be true. Why wouldn't everybody be on a Medicare Advantage plan? And so the answer to that question is, when you enroll in a Medicare Advantage plan, because the company that you're enrolled with is going to be paying the bills on behalf of Medicare, Medicare just sends the company you're enrolled with a check on the back end or stipend to cover those services on their behalf. So that's why it doesn't cost you anything. But the common misconception is that if the plan is $0, I don't pay anything. I go to the doctor for free. I, get all of this other stuff for free. And that's just not correct. So that's another thing that I've ran into. Well, my agent told me that the plan was $0. I just got a bill from ER for $90 today. I just got a bill from my dermatologist for $45, $50. I went to therapy 3 times this week and I just got a bill for $75, $60. And so I thought that you said it was free. So just because you're not paying the company anything, there's still cost share associated with your services. So what you want to do is if you're interested in a Medicare Advantage plan, you want to make sure you're reading your evidence of coverage, or it might be called a summary of benefits. It's going to be that big book that you get once you enroll. And you can also ask the agent that's enrolling you how you should, or how things might be covered. Most preventative services like I said, your colonoscopies, your mammograms, prostate exams, blood work, those are things that are for your good. It's preventative maintenance. So those aren't normally going to cost you anything unless they find something and they need to retest. Then you might receive a bill because now we're going from preventative to diagnostic. But for the most part, those are preventative services, and they should not cost you anything. If you do end up getting a bill, you want to call customer service and see, if you're if the claim was processed correctly, and if the bill is correct. Other than that, like I said, there is some cost share that's associated with a Medicare Advantage plan. The only time, and I tell my people that I come across, the only time you're going to be paying $0 or you're not going to be obligated to pay anything for any of your services is if you have Medicaid. If you are deemed by, like I said, your state as being limited in your finances, then you will qualify for what's called a dual plan. And those are for people dual. You have both Medicare and Medicaid. So, like I said, you have to meet income requirements for that. And check your state. Check your state's income requirements. I can't tell you how many times I've talked to people that were very limited in income, bringing home less than, $1,200 a month. And sometimes it's about $1,200, $1,300 a month. That'll get you right in that range for Medicaid and extra help. I can't tell you how many times I've had people tell me, I only bring home $700, $800 a month, and they weren't on any kind of assistance. It's a struggle trying to pay rent. Everything is going up, right? Except the Social Security checks or whatever checks you're getting. Everything is going up, the rent, the groceries. And I like to tell my Medicare community to get everything that you are entitled to. If you can afford a supplement, if you can afford your own health care, that's beautiful. I mean, God bless you for that. I'm happy for you. But if you're struggling with keeping up with your Medicare Part B premium, check your state's guidelines. Go to the Department of Health and Human Services in your county. If you're having trouble finding that, please leave a comment. I will upload or do another video and leave you some phone numbers and some addresses to how you can find out if you qualify for any kind of Medicaid benefits. Extra help is another one. If you're struggling with paying your co-pays, the Social Security Administration offers what's called extra help, or you might hear it called LIS. LIS stands for Low Income Subsidy. And what that is the Social Security Administration, if they deem you eligible financially to receive a low income subsidy, they will attach a subsidy to your Medicare number so that your prescription drug co-pays are capped. If anybody is on insulin and up, it costs money. Insulin, Linzess, Eliquis. I'm just thinking of some off the top of my head that I'm used to hearing about. But those medications can be very expensive. They're what's called Tier 3 or name brand medications. You can't get around them. They have to, most of the time, there is no generic for the medication that you're on. So these things are costing you $47 and up for a 30-day supply. And if we get into Tier 4s and Tier 5s, I mean, we're talking $100-something and up for 30 and 90-day supplies. And a lot of times for the average Medicare recipient, that's a lot of money. It just can't be, it can't be managed. So if you feel like you're eligible for a low income subsidy, the numbers change. They kind of stay steady, but they change a little bit year by year. But last year, if you were single or married and not living with your spouse, you couldn't bring home, it was like less than $16,000. It's like $15,000 and some change. If you were married and living with your spouse, it was like $29,000. You couldn't bring in more than that. But if you feel like you make that or you make less than that, contact Social Security. Now, I do know their number is 1-800-772-1213. I believe they'll mail you out an extra help form. Don't quote me on that. If they won't, because I don't want you to bombard them for forms, but if you can, I believe you can pick one up from your local Social Security branch, or you can go online to www.ssa.gov/extra help, and you can answer the questions and just fill it all out online. If you are computer savvy, you can go online and do it yourself. If you're not so computer savvy, if you have a family member or a friend or somebody that can help you, if you trust me, if you want me to guide you through it, I have no issue with that. You can definitely leave that in the comments. I'd be more than happy to help. So, like I said, if you have any other questions about what's covered, what might be best for you, I'd be more than happy to answer your questions or make a follow-up video about what moves you should make this annual enrollment period. Don't be intimidated by the calls. They're going to call you regardless. Don't feel, and that's another thing. If you're happy with what you have, please do not let agents talk you into switching over. You're going to want to check and see if your doctors are in network. You're going to want to check and see what you already have, if it is better or the same as what's being offered to you. And a lot of these agents, it's nothing wrong with changing. If another company benefits you better than what you have, by all means, educate yourself and make the switch. But if you love your primary care physician from 1986 and you don't want to let them go, you have one chemo doctor that you just don't want to let go, please be advised that when you switch, some of these plans, they're HMOs. So you have to see doctors that are in network, and there's nothing wrong with that. There's a huge stigma around HMOs that we have to educate ourselves about, but there's nothing wrong with HMOs. You do have to see doctors that are in network, but they're designed to save you money. HMOs are designed to try and save you some money. And this is coming from an HMO girl turned PPO girl turned back HMO girl. Like, I'm okay with all of them, but it's because I'm fairly healthy, so I can't speak on anybody else's behalf. But please beware when these agents call you. Even if you turn them down, they will, if you're okay with what you have, they will try and, I can save you on this. I can save you on your prescriptions. You cannot switch to just a prescription drug plan only if they're offering you a Medicare Advantage plan. They usually come hand in hand. So if you go with another company based on a pitch that they sell you about lowering your prescriptions, you could possibly disenroll yourself from the plan that you're in. So please educate yourself, or I'll educate you. If you have questions, if you don't want to answer the phone until you get some direction, that's okay. Please do not be, like I said, intimidated by the calls. They will bombard you with paperwork and with calls. Don't be intimidated by that. You're not obligated to enroll in anything. If you are already with your Medicare Advantage plan or your supplement plan and you're okay with that, don't let people scare you into something else. Educate yourself. You have until December 7th. If you feel like another plan offers better dental, offers more on hearing, offers implants, offers, more on your glasses, or they have over-the-counter benefits that you really like, that's okay. Just educate yourself. I can't tell you how many times I've talked to members and they wanted to stay with Humana and they got talked into going to Aetna or another plan. They wanted to stay with WellCare and they got talked into going to Humana or Blue Cross Blue Shield or you're a retiree and you mess up your retirement benefits by going to another plan because somebody told you that they could save you on something. Like, just educate yourself, okay? That's all I'm asking. And like I said, if you have questions, please ask me. I love healthcare, and I have a special love for my Medicare members. I love you all so much. Whether you are 65 or you're 25, I have a heart for you all, and I want to be the best advocate that I can be. My goal is to advocate for my Medicare community as much as I can. Later on down the line, I would love to do seminars every annual enrollment period for the ever rapidly growing Medicare community. So like I said, please leave me a comment if you are a family member of someone that's on Medicare, or if you're just someone listening in and you're on Medicare, or you're getting ready to be on Medicare and you need to know how to go about it. Please leave me a comment. If you like my channel, please subscribe. I will try. I love educating the masses, so I will answer you as soon as I can. I'll put up, new videos. And if you've ever talked to me before on the phone, welcome. I'm glad to hear from and see you again. So like I said, please let me know. I will answer your questions in a follow-up video, or if we need to communicate via email or something like that, please let me know. I'd be more than happy to help you so that you're not trying to navigate through all of these choices by yourself. So I thank you for listening. Like I said, please don't hesitate to ask any questions if you have any. And until next video, God bless you.